Okay, welcome. It is March 25th, 2025. I'm Dr. Duke Majan. We are here for our last surgery of the day. This patient travels here from Kansas, and he's here with his lovely wife. They came to us because he's been suffering with back pain for 5 years. And it turns out he's got 2 discs and 4 facets that are causing all of his back pain. We're going to fix that today. He also has neck pain from facet joint pain. We're going to fix that later as our second case. So Henry, we're going to get started by fixing L4-5, L5-S1 discs.
Yes.
And because there are so many different causes of back pain, everybody has a different story. Show us what are the most common causes of back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. You can see from the video that there are a lot of things that can cause back pain, but the most common by far is a disc injury. That is the most common cause of chronic back pain. Now, I'm not counting something called acute back pain. Acute back pain is like if you get a car accident and suddenly you whiplash your lower back and it hurts for 2 days after the accident. That's not chronic back pain. That's what we call acute back pain. Acute means it's just, less than basically 48 hours you've been having pain. But I'm talking about chronic back pain. Chronic means longer than 3 days, and we typically will say 6 weeks. So if you've had back pain for more than 6 weeks, which this patient's had it for 5 years, then it turns out the number one cause of that back pain is a tear in the back wall of your disc. And that's what this surgery fixes, is that tear. And it does it by using a laser to clean the tear, get rid of the herniation, get rid of the inflammatory tissue that's in there, and that allows your body to heal your disc naturally. So this surgery replaces fusion, artificial disc, laminectomy, foraminotomy, spinal cord stimulator, disc seal, mild procedure, microdiscectomy, discectomy, foraminotomy, partial facetectomy, all those different kinds of treatments that doctors do that don't work for back pain, this treatment does. And it not only is it the most effective treatment in the world for back pain, but it's also very effective for leg pain and pinched nerves. And that's what the last patient had. And Dr. Berndes tells me our last patient, who's, I can tell you, he's a Harvard professor in biochemistry. He actually had weakness of his foot, and now that weakness is gone. So he's able to pick up his foot in recovery room right away and start moving his foot normally. So not only does this surgery fix back pain, but also leg pain. Look at this herniation right here we just pulled out. It's not a big one like the last surgery, but it's a good size. And it's a good start to this surgery. Any questions from our audience?
Yes. We have a question coming from Pawn Lust on YouTube, asking, to access a posterior herniation, is transdiscal your approach? I don't see how else to access it. I mean posterior as in near the cord.
I don't know. Pawn Lust, great question. I don't know if you're talking about lumbar or cervical or thoracic. So which part of the spine are you talking about? Because our approach is different depending on the part of the spine. This scope is perfect, by the way, the image. And it's just overexposed. Can we turn down the lighting by 2 clicks? Perfect. I don't think it went down. You pressed the wrong button.
Yes, please. Good.
There we go.
Thank you.
That's good. Thank you. All righty. Any other questions?
At this moment, no current questions. Still waiting on Pawn Lust on YouTube to see if it's cervical or thoracic or lumbar that they're asking for.
Thank you. So in the meantime, Henry, let's show the audience how do these disc injuries called disc herniation, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, degenerated disc, spondylitic disc, how do these injuries of the disc cause so much back pain and leg pain?
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, so I think Pond Lust's question is directed to the thoracic.
Yes, Ponlus said, I was thinking thoracic. I believe I remember you saying that the tube is 2.8 millimeters. The discs are also a lot thinner, so it makes me think about how that may be more difficult for that reason too.
Yeah, I'd be happy to talk about that. But first of all, the video you just watched shows how do disc injuries, which are the #1 cause of chronic back pain, they account for 86% or 85% of all primary chronic back pain based on our research and data that we've collected on 5,000 patients here at Duke Spine Institute with back pain. I submitted that data for publication. We're waiting to hear back. I would be surprised if they accept it. The system is so corrupt that even our journals are now controlled by the companies that sell the implants. And they control the editors, they control all the journals, the articles that are published. Not only them, but also the insurance companies control journals. So if a journal isn't controlled by a special interest group that is the implant company, it will be controlled by the insurance companies, another special interest group. So basically, the old system of medical research and peer review and publication has been corrupted, infiltrated, and destroyed. It is no longer reliable. Okay, getting back to the video you just watched. So we know that the #1 cause of back pain is disc problems. That's why we do so many Duke laser disc repairs. And Pond Lust is one of our viewers who's asking, how do you get to a thoracic disc herniation? Because you told me the tube was only 2.8 millimeters. So the tube is 2.8 millimeters. That is the internal diameter. The outer diameter of the tube is 4 millimeters. And for thoracic herniations, we can actually use a larger tube, which is 7 millimeters, so we can use a larger scope and a larger laser fiber in most patients. It depends on which level we're talking about. But we'll use either the larger tube or the smaller tube. But to get to a disc herniation that's in the center, you actually have to go on both sides. So we go transforaminal. Now, what are the options for a patient who has a herniated disc in the thoracic spine that is compressing their spinal cord? They actually have several options. So let's look at each one. One option is to go transthoracic, which means across the thoracic chest cavity. That means go where the lungs and the heart are. Very dangerous, possible, but you have a high risk of complications involving the lung, the heart, and blood vessels like the aorta. Okay? So we don't usually recommend it, but it's very invasive and very dangerous. Then you have endoscopic transthoracic, which is done again through the chest cavity, dropping a lung. You need an anesthesiologist, a double lumen endotracheal tube, and you have to drop the lung and you have to be ready to save that patient's life if you damage the heart or lung. So it's very risky. Chance of serious complications is about 25% for that surgery. And only a few surgeons in the world know how to do it. Then you have open surgery called costotransversectomy, where you remove part of the rib and the transverse process and you approach the herniation from the side, but you have to remove part of the rib, and you can also damage the lung again. And of course, the patient's going to have horrible pain afterwards because you remove the rib and you damage the nerve under the rib. Plus, it's very, very dangerous surgery and the risk of complication is very high. The risk of serious complication is around 25% again. But it is possible to get to a herniated disc that way. Even do a fusion in the front of the spine. I've done those surgeries. I don't do them anymore. For the most part, they're unnecessary. They're usually reserved for very serious cases where the spinal cord is being pinched by either a tumor or a fracture of the vertebral body or an infection in the spine. So, very serious, complicated case. Requires mobilization of muscles, removal of lots of normal bone, including ribs, transverse process. Even the vertebral body can be removed. And you run the risk of damaging the lungs, the great vessels, things like that. So very, very dangerous. Then you have what's called transpedicular, where you come from the side and back and you go through the pedicle. Once again, high risk. Then you have laminectomy. And laminectomy is not really fixing a disc problem, but it's just getting rid of the bones in the back of the spine and ligaments. It's sort of the easy way of dealing with the herniated disc and cord compression, but it's not very effective at fixing the problem. But it's something that even the lowest trained surgeon can do usually, and but it's not a very effective treatment. Then you have the best treatment in the world, which is the Duke laser disc repair, which is what we do. And that is the safest and most effective treatment to deal with a herniated disc that's not calcified, that's that you go through a bilateral transforaminal approach, and that's with the small tube and the laser. That's what I would recommend, and that's what we do here at Duke Spine. So, patients have a lot of choices when it comes to how to get to a thoracic disc herniation, but most of those choices are dangerous, have a high complication rate, they're long recovery, very painful, require lots of narcotic painkillers, have a high chance of having issues afterwards, and I wouldn't recommend it. The laser surgery we do is very successful, and it's minimally invasive. So there's really no hospitalization. We've never had a complication, and patients don't need any painkillers afterwards.
We have a couple more questions.
Sure.
Next one coming from Michael on YouTube, asking, in a disc protrusion, do you go through the back of the disc as well, or just work within the disc? Is a disc protrusion a tear that's not completely through the annulus?
So disc protrusions are disc herniations. They're the same thing. There's no difference. And a disc protrusion in the lumbar spine, like this one right here, that we're dealing with for this patient, you go through the back, called the posterolateral approach, which is what I'm doing, and it's going through the foramen, which is a natural opening in the spine, so we call it transforaminal. And I use a laser to remove the herniation. That's what I'm removing right now. That whitish blue stuff is the herniation. The pink thing over there is the bone, and that's the vertebral body end plate. That's the back of the vertebral body end plate. I'm removing the herniation that is sticking out backwards. These white fibers here are annulus fibrosus. They've been torn, and that's where the herniation is sitting. The other end plate is going to be right there. You guys see that? The other end plate's right there. So vertebral body to vertebral body, we're inside the herniation, and that's what we remove. We don't remove the disc. We don't take the disc out. We don't go through the disc. We go through the foramen and get directly into the herniation without going through the disc. This is the tear and herniation we're in. So we don't do any damage to any of the normal part of the spine. Unlike every other spine surgery out there where they damage the normal parts of your spine to remove your disc, which doesn't need to be removed, by the way.
Next question coming from the classic Carnut on YouTube, saying, "Hi, I received a screening invitation to Spine Scam, but was unable to join that day. I'm very interested in watching it. When will it be available? I emailed Kim, but haven't heard back. Thank you." I can answer.
Of course.
The next screening, we wanted to get multiple screenings before the actual release. So, because our director is editing it, is editing a little bit more after this last screening that we just had. So, whenever that next screening will be, we can put you in a personal email to send that invitation / Zoom link out for you. Not a problem. So we can I could talk with Kim about that. So don't you worry. For the next time we have our screening, which will be soon, we'll let you know. Not a worry. And then next question just comes from Cindy on YouTube.
Hi, Cindy.
Asking, do you do revision surgeries on back cages at L4-5-S1? Thank you.
Yes, I do revision surgeries. Happy to help you, Cindy. What you need to do is go to our website, dukespine.com, and submit your MRI for me to review it. If you have some x-rays, we'll take those. If you have a CAT scan, we'll take that. And I'd be happy to tell you what's wrong and what needs to be done to fix your problem. And yes, I do revision, absolutely. I do whatever I can to help people get out of pain and stop their suffering. So revision surgery is often necessary. I'm sorry you had such a problem, but good news, you found us and we can help you.
Next question coming from Pawn Lust once more on YouTube, asking, if you're able to see end plates, are you also able to help with the rare symptomatic schmoral nodes, or is it not worth the risk?
Okay, first of all, so great question from Pawn Lust. He's asking if I'm able to treat Schmorl's nodes. The answer is yes, but I would never treat a Schmorl's node because Schmorl's nodes do not cause any symptoms or problems at all. Schmorl's nodes are to back pain what your eyebrows are to back pain. They have, yeah, Schmorl was more of a troublemaker than his diagnosis, okay? Schmorl's nodes are not a disease. Diseases are conditions that cause symptoms. Schmorl's nodes are not a disease, they're just a finding. And they do not cause any symptoms, and I would never recommend anybody get one treated. There's a lot of scammers out there. They'll take your money. They'll subject you to surgery or treatment for something that doesn't need to be treated. That's another reason to go to Duke Spine, because we will never scam you or take your money for something that doesn't need to be treated. It's not something we'll ever do, as long as I'm alive and running the show.
At this moment, no current questions.
Thank you. We're just about done here. This is another extremely scarred up disc, and it's taken a lot of energy. How much have we dumped into this one? Probably around 40? 28.55. All right, only 29, so it's not as much as I thought. Our last patient took a full 65 joules of energy in one disc on one side. Actually, total on both sides, 120 joules. That was our Russian patient. All right, we are pretty much done with this disc. We're going to move on to the next one, which is going to be L4-5. We're currently at L5-S1, and it's gone really, really well. You can see the inner diameter of the tube is about 5.5 millimeters. The outer diameter is 7 millimeters. So that tear that's left there right now that I've cleaned up, that tear is only about 3 millimeters wide. Remember, the laser fiber, the glass part, is 1 millimeter. So basically this tear will heal up pretty quick now that we cleaned out the herniation. He's moving a little bit. All right, good, we're done there. Let's see if we can see his nerve. His nerve is in that fat, so we couldn't see it. But we're done with this disc. We're going to move on to the next one. Thank you. Any other questions?
At this moment, no current questions.
I'm so happy you guys are asking questions. It's great to get them. That's why we're here, folks. We're here to help you get answers. We're here to help you get the truth about back pain, neck pain, how to fix it, the right way to fix it, the best way to take care of yourself and feel better permanently. These treatments are permanent. Our disc repairs are permanent. We have a small number of patients that re-herniate their disc and come back with pain. It's 1 in 100. That's our number. We've done now around 2,500 laser surgeries, and we've had 25 patients re-herniate and need to have it redone. So that's 1%. 1%. That's much better than any other surgery out there. Other surgeries have a much higher re-herniation rate and revision rate. And the thing about it is, patients that re-herniate, I would say 90% of the time they'll tell me that they did something they weren't supposed to do. Oh, I picked something up that was really heavy, and then I felt a pop, and I realized I re-herniated. So at least they admit that they did something they weren't supposed to do. So if you subtract out the people who get the surgery and, are bad because they behaving badly, they're doing things they're not supposed to do. If you take that 90% of the 1% out, that makes our re-herniation rate for people who at least do what they're supposed to do, what is it, 1 in 1,000? So 0.1%. That's better than any other surgery in the world. Yep. And we've never had a complication with this surgery. 19 years. And by the way, this June, we're going to hit 20-year anniversary for this procedure, Duke Laser Disc Repair. We're going to have a party and we're going to have pizza. I'm going to buy Brooklyn pizza for everybody, unless you guys have a better suggestion. We could do Mexican. We can do whatever you guys want to do. Just give me some suggestions. I don't know. We're going to have to figure it out. What day of the week do you want it to be? Oh, it will be a Tuesday or Thursday. I just don't remember the exact day. I just remember it was June of 2005. So we're coming up on 20 years. We'll make it Thursday. Laser. All right. Any questions from our audience?
Yes, we have a question coming from Pawn Lust, once more on YouTube.
Oh. Hit my eye.
Hit your eye?
Yeah, but just leave it for right now. We need another fiber. Will you go grab one? Don't unplug it yet. I'll take the question.
Question coming from Ponlus once more on YouTube, asking, the outer annulus has nerves, and why would a vertical herniation with a non-healing tear not cause pain? Plus, the end plates have nerves too. I don't understand why they wouldn't cause pain standing.
Well, that's a great question, Ponlus. First of all, the end plates never cause pain, ever. It's basically a false lie that they cause pain. And there's a company selling a product that wants people to believe the end plates cause pain, but they don't. Never. That company, I won't mention their name, but they are a multi-billion-dollar company, and they sell a treatment that treats pain from the end plate, and it does not work. Okay? Basivertebral nerve ablation does not work. Does not work. I've never gotten it to work. I've met lots of patients that had it done, and they're still having the same pain they had before. It doesn't work. So end plates just don't have the pain fibers that cause pain. So that's why they don't hurt. Even though you get modic changes and all kinds of stuff that look bad on the MRI but don't cause any symptoms. Okay? As far as why doesn't an annular tear with herniation always cause pain in every patient, I don't know. I have some theories, but I don't know why. How are we doing, guys? You ready?
Yeah, we're ready.
Give me 10 seconds and we'll do it. We're going to change out the fiber. The loop of the fiber hit my eyeball, so it's now contaminated. We're going to get rid of it off the field. Change to a new one. It's one of the risks of being a surgeon, being injured in the operating room. And you can be injured. Think about it. We're dealing with lasers and scalpels and rongeurs, sharp instruments, hammers, all kinds of stuff. So you got to be super careful. Have I ever been injured in the operating room? Yes, one time. It happened with the laser. The laser fiber broke in my hand, and the energy from the laser went into my finger. Are you ready or not? Oh, that's it? Yeah, I still have a scar on my finger. There's a white spot, and it's never gone away. And that happened 20 years ago. Virtually on the second week I did this surgery. Yeah. I was twisting the fiber like this, and I twisted it against the mouth of the port here at the back of the endoscope, and I cracked it. And my foot was on the pedal, driving energy through the laser, and it went straight into my finger. It literally came out the backside. I put a hole through my finger with the laser. So even to this day, I have a scar. I've had one injury in the operating room, and there was the laser. So the laser has never hurt a single patient of mine, but it's hurt me. People always say, can the laser harm me? Can the laser hurt me? No, it won't, but it hurt me, the surgeon, right? How funny. I've never had that problem again because I'm more careful. You know, I understand that glass can break, and once it breaks, it allows the laser energy to be channeled right into my finger. So you just got to be careful. And I've never had that problem again in 20 years. Literally, it happened the second week that I did surgery, and then it never happened again. And I remember the feeling of that laser hitting my finger. It was unbelievable how painful it was. And it was like an electric shock. It was like, it was like unbelievable. It was like being electrocuted, but with laser energy. is no joke. This thing is a beast. It can melt through steel, so you can imagine what it can do to you if misused. People ask, are the lasers dangerous? They're not dangerous in the right hands. If you have somebody who's skilled and knows what they're doing, they're not dangerous. They're no more dangerous than any other surgical instrument, like a knife, right? Or a rongeur or anything. Like, we have tons of dangerous instruments that we use, but as long as you use them properly and carefully, they can't really hurt anybody. All right, any more questions?
Yes. Next question coming from Jack once more, Jack on YouTube asking, Doctor, do the nerves of the facets that are zapped with your plasma have any functions other than signaling pain?
That's a great question, Jack. The answer is no. You hit the nail on the head. All they do is signal pain. And when your facet joints are damaged to the point where those things are signaling pain every time you move, they need to be eliminated. They need to be removed, destroyed. And that is the best treatment in the world for those facets, because it's so safe, it's quick, and it's totally effective. And we're about to do that procedure on this patient. As soon as we're done fixing his discs, we're going to go in and fix his facets. Not just his lower back ones, but also the neck. We're going to do cervical and lumbar. So he came from far away, and he wants everything fixed, and that's what we're going to do for him. Great question.
Next question coming from Lance on YouTube.
All right, I got about 3 minutes to 5 minutes left on this disc, and then we'll be ready to move to his facets. Lumbar facets.
Lance on YouTube asking,
I hear you.
what's the youngest age patient to undergo Duke laser disc repair?
Yeah, the youngest age was 15. I remember her. I know her name. Huh? Oh, 14. I'm sorry. All right, you're right. I apologize. The youngest lumbar Duke laser disc repair is a 15-year-old girl. And the youngest thoracic Duke laser disc repair was a 14-year-old boy. Yeah, basketball player. He did amazing. He was in a wheelchair. Huh? 14 years old. He came from Seattle. Very nice family. He went to Seattle Children's Hospital. They basically blew him off, saying, "You'll be fine. You're probably just having Osgood slaughter disease." I know, but he was having leg pain. So they diagnosed him with Osgood slaughter disease when he actually had a thoracic disc herniation that was squeezing his spinal cord, causing him to go paralyzed. By the time he came to Florida, he went from being walking with weakness to being in a wheelchair. He couldn't move his legs almost. We did his laser surgery on both sides. It was like T11-12. And then he was up walking within a week. And his mom sent me a video of him on the basketball court running with the basketball playing about a year after surgery. So the youngest is a 14-year-old boy, and that was for thoracic with myelopathy. But yes, we've had some young people. Young people do get herniated discs, and they need to be taken more seriously, because doctors and family members just kind of ignore their complaints for the most part. Sad too, we've had a few youngins that we recommended the laser surgery because they're in pain and their parents didn't do it. And I'm sure they could have done it, but they chose not to. So those kids unfortunately live in pain because the parents are unwilling to do this treatment that they need. They talk to their pediatricians, and the pediatricians tell them, don't do that. Surgery. Thanks. All right, so this is another one of those herniations that are taking a really long time. There's the end plate, by the way. We talked about it earlier. You guys see it on the left? It's pink. Can't see it right now, but I'll show it to you in a minute. There, it should be right there. You guys see that? Right there at 12 o'clock. That is the end plate. End plate is the bone. It's the surface of the bone of the vertebral body. And you can see how I use the laser to free up fragments of herniation, and then I bring the grabber in to pull them out.
We have a question coming from Pawnlust, once more on YouTube,
Sure.
asking, was that 14-year-old thoracic surgery not on video due to age? Also, how the heck do they miss a thoracic herniation if he can't walk well?
Yeah, great question, Pawnlust. So basically, when he presented, he complained of some weakness and numbness in his legs. They didn't examine him properly, and they just wrote it off to Osgood-Schlatter disease, okay, which is not really a surgical disease, and they told him just, you'll grow out of it, you'll be fine. And then he wasn't in a wheelchair at that time, but for all purposes he could have been. They would have just ignored him just as well, because doctors are sloppy these days. They don't really pay attention, they don't do their job properly, do an investigation. And what happened was, the MRI did show a herniation. The herniation was not that big. It was touching the spinal cord, and it was starting to deform the spinal cord. But it was not a humongous herniation. But nobody wants to operate on thoracic disc herniations, especially in a 14-year-old. Surgeons are scared to death. They don't know how to do it. They're worried they're going to hurt the kid. They're worried they don't have the skill, and they don't. They don't have the skill to fix somebody like that and that problem like that. So they just tell the patient to wait and they'll get better, and they just kind of kick the can down the road. That's really what they're doing. They're kicking the can down the road because they don't want to treat that patient. They don't have the ability to. They don't want to say, I don't know how to do this surgery, or I'm not capable of doing this surgery. So what they say is, you don't need surgery, right? It's a lot easier to say you don't need treatment than to admit that you don't know how to do the treatment. If you start telling people you don't know how to do treatment, patients are going to stop coming because the word is going to spread. So doctors are all afraid of the repercussions they'll have to face of being honest about themselves with their patients. And it's a shame doctors have to hide the truth from their patients. And they end up telling the patient things like, you don't need surgery, when they actually do. Because who wants to admit they're incapable? Right? What's easier to admit in life? You're incapable or that you're wrong? Most humans will admit they're wrong before they'll admit they're incapable. So, you're dealing with people here. Doctors are people. They have deep, complex psychological ego defense mechanisms that they don't want their egos being damaged. Their image of themselves or the public's image of them. Basically, it's psychopathology. Doctors drink alcohol too. Doctors become addicted to drugs. Doctors become alcoholics. They're people like everybody else. They're susceptible to the same diseases the rest of us get. And they don't like to admit it. After all, if you admit that you don't know how to do something, you have to, basically the patient could go to the medical board, complain about you, and then the medical board launches an investigation on the doctor. And then the doctor is afraid of that, being deemed incompetent by the medical board or board of peers, right? So you're just dealing with basic defense mechanisms. That's why the 14-year-old did not get the care he needed, and he ended up becoming paralyzed. And I unparalyzed him, but I wouldn't advertise that I'm an unparalyzer. We just got lucky. The timing was right, and the surgery went well, and he was unparalyzed. So what? It does happen. We don't want to advertise that though, because I don't want everybody calling me saying, unparalyze me. I'm sorry, I can't. All right, we're done here. We're going to move on to the facets. Any other questions?
Yes, this next question coming from Andy on YouTube.
Andy on YouTube, nice to meet you.
Asking, given 3 spinal fusion surgeries, including an anterior/right lateral/posterior procedure, and the use of permanent spinal stimulator and epidural injections,
I'm so sorry to hear this.
what is the prognosis?
If you have back pain, I will fix it. 100%.
And
you
then,
just have to be willing to get it done.
And then lastly, from Andy once more on YouTube, asking, I have experienced a complication at the L3 vertebral level following a lateral surgical approach. Did the surgical procedures result in a procedural error?
Well, it depends on your complication. I need to know what the complication was. And I need to know what surgery there was. I don't know if you had an X-lift, an O-lift. I'm not sure what procedure you had done. But then I need to know the complication. I need to know the procedure you had done. And the timing of the complication to the procedure. Was it immediate? Was it delayed? So all those are variables in determining that. But I can determine it. And I can tell you, and I will tell you. All you got to do is an MRI review with me. Just get your MRI submitted. It's free. We don't charge any money. You get it for free. You get 10 minutes of my time for free. And I'll tell you exactly how we're going to fix your back at the end of those 10 minutes. All right. Thanks, everybody. We'll be back in a minute with our facet. Duke plasma rhizotomy lumbar, L4-5, L5-S1 bilateral, and then we'll move on to the last part of the surgery, which is the cervical facets in this patient who traveled all the way here from Kansas. All right. Thank you for